Guillain-Barré syndrome. What is Guillain-Barré syndrome? It is a rare pathophysiological disease in which the body's immune system attacks the nerves. There are currently no known cures, and it has a mortality from 4 to 7%. This is an autoimmune disease that results in nerve damage or functional blockage of nerve conduction. Within this, the immune system attacks the myelin sheath of healthy nerves, as pictured here, but it is through the body's ability to heal the myelin sheath that allows recovery. The exact cause of GBS is unknown. Typically, it appears within days or weeks after a respiratory or digestive tract infection, after some surgeries and vaccinations, also following the Zika virus, as well as COVID-19. Some common risk factors can include things such as age. An increase in age is an increase in risk. The most common risk factor is an infection from Campylobacter, which is a bacteria that you receive from eating undercooked poultry. You may also be at risk if you have had influenza, hepatitis A, B, C, and E, been diagnosed HIV positive, or recently had surgery. Symptoms begin typically with a tingling sensation or weakness in the extremities that starts spreading throughout the body. People who have GBS have a difficulty walking or using stairs, double vision, difficulty breathing, a change in blood pressure, loss of bladder control and bowel movements, and they may also have severe pain, especially at night. These symptoms are often symmetric in such that if you have tingling or numbness in the left leg, your right leg will also be having the same symptoms. Complications, as pictured with patient X here, had difficulty breathing. There was lasting numbness and tingling, nerve pain, controlling excretory functions, blood clotting, and bed sores from remaining in the hospital bed for so long, and less than 10% of individuals with GBS relapse. The diagnosis process is difficult because there are so many similarities in symptoms with other neurological diseases, and these symptoms may vary from person to person. Physical examinations and patient history are typically the first step in diagnosis. However, spinal taps in the lumbar region, as pictured here with patient X, he ended up receiving 14 punctures. They may also use electromyography and nerve conduction studies. Some common branches are AIDP, which is most common in North America and Europe. The most common symptom with this particular branch is muscle weakness in the lower part of your body that spreads upwards. The MFS branch is most common in Asia. This has an unsteady gait and a paralysis that usually starts in the eyes. AMAN and AMSAM are most common in China, Japan, and Mexico. And with this particular branch, there's weakness of the limbs that is often paired with respiratory failure. There's currently no cure for Guillain-Barré syndrome. However, treatment such as plasmapheresis and immunoglobulin therapy, as well as physical therapy, have proven to help. Patient X received the IT, in which the immunoglobulins are developed from a pool of thousands of normal donors, and it is given to the patient because this will result in a lessening of the immune attack of the nervous system. It can also shorten recovery time. This lowers the levels or effectiveness of antibodies that attack the nerves by both diluting them with a nonspecific antibody and providing antibodies that bind to the harmful antibodies and take them out of commission. So in a sense, it blinds the body's antibodies from being able to attack itself. A typical timeline, your symptoms occur, and then over the course of 2 weeks, the condition worsens until you hit a plateau at about 4 weeks, in which recovery will begin. Pictured here is patient X before and after the hospital at 175 pounds and 138 pounds. This resulted in a loss of 21% of body weight. And the difference in these photos is only 45 days. That's 6 weeks and 3 days.